This is the new home of the Central Medicine Stores located in Caldwell, Monrovia. This modern state-of-the-art facility was built by the government of Liberia at a cost of $5 million United States dollars with support from the Global Fund, Gavi, and from the United States Agency for International Development, USAID. The construction of this modern facility and the relocation of the Central Medicine Stores to Caldwell together represent the final step in the supply chain master plan that the Ministry of Health designed and implemented in conjunction with partners to address the public health supply chain challenges in Liberia. During 2015 and 2016, the National Drug Service called Central Medicine Stores at the John F. Kennedy Memorial Hospital in Monrovia was faced with many challenges in its commodity supply chain. Among others, there was rampant drug theft, no visibility into the inventory of commodities procured, poor drug storage conditions, warehouse fires, lack of financial accountability, and little knowledge on whether the drugs were actually being delivered to the intended health facilities or not. This dire situation commanded the attention of Her Excellency President Sirleaf, who visited the NDS to witness the challenges firsthand.
Drugs have been destroyed, vaccines can no longer be used. It has to be a thing like this.
At the request of the Ministry of Health, the United States Agency for International Development, USAID, through its implementing partner Chemonics International, accepted to support the implementation of the Ministry of Health Supply Chain Master Plan with the overall goal of transforming Liberia's public health supply chain.
Under the supply chain reform activities, we had several line items that we had to address. The first one was the consolidation of all Ministry of Health warehouses within Monrovia and Montserrado into one interim location at Freeport. We were able to successfully consolidate 11 warehouses into that location. The next step was the inventorying of all commodities within the warehouse to ensure that we have insight into the commodities procured and also stored as well. So we conducted 2 inventories, and the reports on those were very well received within the ministry. In addition, the next step was the regularization of the distribution of commodities to all the county health depots in the country, and we have successfully been able to do that since July of last year, of 2017, up till today. So the regular quarterly distribution is ongoing and interrupted to all facilities in the country. And then another item that we looked at after that was the documentation review. It became clear during our review of the weigh bills and other shipping documents that the signatures that were required to release commodities out of the warehouse for delivery were actually too many. On the weigh bills, it became apparent that 11 signatures were needed before a commodity could actually leave the warehouse. So we were able to work with the ministry to revise that and update it to a new format that requires only 3 signatures. By so doing, the time taken from requesting commodities to actual delivery of commodities fell from 2 months to less than a week, which was a great success for that.
The supply chain master plan was developed thanks to the support from international partners, and we have started implementing the plan to optimize healthcare delivery in Liberia. Amongst other things, we have decided to consolidate all the warehouses. There have been multiple warehouses. Each program had their own warehouse here and there. There were parallel supply systems. Everyone supplied at different times. So we try to coordinate that, making sure first we have a consolidated warehouse, which we did successfully at the Freeport. We collected all the commodities from around the country, around the city, and took them to a specific location, making sure they were safe, kept under the most optimal conditions to make sure that efficacy and potency is protected, and most effectively compartmentalized, so we see what is where, and when we're ready to supply, we can just go and get the commodities we need in a most efficient manner.
Working together with the CMS and other partners in the health sector, the USAID Global Health Supply Chain Procurement and Supply Management GHSC PSM program in Liberia embarked on several supply chain system strengthening activities geared at transforming the health supply chain.
Some other supply chain reform activities included the revision of the facility listing to where the commodities were going to be delivered. It became apparent that there was no approved listing of facilities within the country where commodities could be finally delivered, and as such it would be as though commodities were being delivered endlessly to endless destinations. So we worked with the ministry and partners to synchronize the listing of facilities, and were able to generate an approved facility listing where commodities could be delivered. This approved listing has been used for all the distributions that we have made, and holds in line for accountability and clarity in the distributions.
In addition, working together with the Ministry of Health, the GHSC PSM program implemented other supply chain reform activities, including the development of an approved list of health facilities, the development and implementation of warehouse standard operating procedures, the national quantification of all commodities to be procured by the Ministry of Health and all its supporting partners, as well as training the ministry staff in the areas of inventory, warehousing, and pipeline quantification software.
We also worked with the Central Medical Stores to develop the SOPs for the warehouse, and the SOP was approved, implemented, and it is something that is being used and will be relayed to other facilities lower at the county and so forth. And then on top of that, we conducted trainings relating to inventory, relating to warehousing, relating to quantification, pipeline software, and the like, Quantimed. And the training actually that we use for the pipeline is the same that was used for the national quantification of commodities for the next year, the year to come, and the third year out, for the ministry and all partners in the health sector to use as a guide and basis for procurement and planning going forward.
Also, the program encouraged the ministry and its supporting partners to visit the consolidated warehouse at Freeport to see firsthand the storage and inventory status of the commodities in a bid to build confidence in the reform efforts. Further, the project created visibility into the commodity deliveries throughout the country by putting together a 3-man delivery team. The team comprised of a Ministry of Health staff, a county health team staff, and a Chemonics staff. The project ensured to take at least 20 pictures for each delivery and share the pictures widely with all stakeholders to create visibility for all deliveries. The commodities that were delivered under the integrated mechanism were procured with support from USAID, UNICEF, UNFPA, Pool Fund, WHO, Global Fund, and the Ministry of Health. The regular integrated commodity delivery was the second step of the Ministry of Health Supply Chain Master Plan. However, maintaining the routine and regular delivery of commodities did not come without challenges. Key among these was the very poor road conditions. During the rainy season, it took the project a total of 18 days to deliver commodities to the furthest county, a distance that should have taken less than a day on a good road. In addition, there were very many stock-out reports throughout the country due to lack of visibility into the inventory and supply chain processes.
There are several challenges, as you can imagine. The first one is the road network. Especially in the southeast of the country, Right now, as per our records and metrics, it shows that it takes 18 days to move from Monrovia to the farthest location that we distribute in the southeast. It's not because it is far, but the road challenges. In some cases, during the rainy season, you'll get to sections where the roads have actually been washed away and the trucks cannot physically move any further. At times the road is so flooded, we have to create a new part road. So we are also in the road construction business, we are also in the bridge making business, and also the normal delivery business as well. So that is a very huge challenge for us. Also, in between deliveries, there used to be very many emergency orders. Because there was no visibility in the distribution, there was no visibility in the inventory, and the distribution was not regularized, there was a lot of emergency orders and stockouts.
The final step of the Ministry of Health Supply Chain Master Plan was the relocation of the CMS from the interim warehouse at Freeport to its new home in Caldwell, Monrovia. The GHSC PSM project worked with the CMS in both the preparatory planning and actual movement of the commodities across the warehouses. Among others, the project successfully conducted a warehouse mapping activity of the Caldwell warehouse, provided security for the commodities in transit in at Caldwell, and also provided operational support to the CMS, including utility and other payments. Because of the significance of the relocation of the CMS from Freeport to Caldwell, the move was monitored personally by the ministry's senior management team, including the Minister of Health, the Chief Medical Officer, the Managing Director of the CMS, as well as the USAID Mission Director, Dr. Anthony Chen.
The establishment of the Ministry of Health's Central Warehouse is a very important step in our work to improve the health supply chain management in Liberia. The results of this work with our Liberian partners speak for themselves. Liberia will save $1 million in rent per year as a result of the consolidation of this warehouse. Emergency orders for commodities and medicines have dropped significantly from about 300 per year to around 10. The percentage of facilities that have run out of antibiotics has declined from about 80% to less than 30% over a 2-year period. Similarly, the percentage of the facilities that have run out of first-line malaria treatments has gone from 39% to 10% over that same period. And the turnaround time for routine distributions have gone from a matter of months to weeks. We should all take pride in these achievements, but our work has just begun. In fact, today we begin a new phase in that work, one in which the Ministry of Health is better positioned to lead, monitor, and execute the timely delivery of medicines and health commodities to all Liberians across the country. We have no doubt that this will help us achieve our ultimate objective: healthy Liberians capable of leading their country on its journey to self-reliance.
Going forward, the project will support the Ministry of Health to implement, among others, the nationwide rollout and of the Electronic Logistic Management Information System, ELMIS. In addition, the project will also support the regular implementation of the End User Verification, EUV. Further, the project will also continue collaborating with the Ministry of Health Supply Chain Management Unit, SCMU, to strengthen technical committees such as the Supply Chain Technical Working Group, which reports to the Overall Technical Oversight Committee, TOC. The project will also continue supporting the Ministry of Health efforts in implementing the regular commodity distributions throughout the country. Lastly, the project will also continue providing operational support to the CMS at the new Caldwell location.
Mr. Chan, on behalf of the government and people of Liberia, we are grateful to the U.S. President's malaria initiative. Helping a pandemic country like ours is indeed a lifesaver and a life-changing moment. We're really grateful to the American people.
From the American people to the people of Liberia,
We want to reaffirm our commitment to ensuring that the medication will be used for the intended purposes, that it will go to the last mile. And I have a personal motto, and I want to sell that to everyone at NDS and also the ministry as a whole. We will not rest. We will keep doing our best till the last pill is served to the ill. And I look forward to continuing the conversation in the weeks, days, and months to come.